Hello, my name is Lucy McKenna, student number N9452303, and I am a fourth year student completing the final semester of my bachelor's degree in paramedic science and nursing. I'm recording this video as part 2 of the CSB346 assignment, Reflection based on professional paramedic practice. I will be reflecting on the topic of interprofessional communication and its relevance to my future practice as a paramedic. In particular, I will be focusing on the negative effects that inaccurate interprofessional communication and clinical documentation may have to patient safety. Upon reflecting on the topic of interprofessional communication, one case from my clinical placement especially highlighted its importance. In December of 2014, I completed my first 6-week clinical placement with the Queensland Ambulance Service. One afternoon, in my second week on road, we were called to a middle-aged woman who was found unconscious following a heroin overdose. The woman was treated with oxygen and 1.6 milligrams of intramuscular naloxone, the maximum adult dose. Upon arriving at the hospital, the patient was triaged and the bedside handover was commenced. At the time, she was stable. The first officer of the case was providing details to the nurse regarding it and our management with naloxone. He quoted incorrectly the time that the dose was administered by approximately 40 minutes. Listening in, I spoke up to the nurse and reported the official time of the administration. As the half-life of heroin is greater than that of naloxone, this information is an important aspect of that patient's clinical treatment. The following year, upon returning to university, I discussed this case with one of the lecturers at QUT. She highlighted to me that patient handover and clinical documentation is where we as paramedics are best able to advocate for our patient safety. As paramedics deliver their patients into the emergency department, continuity of care must be achieved through accurate and informative clinical handover. Clinical handover is an area of high risk to patient safety, and if not performed effectively, the World Health Organization 2018 defines patient safety as the absence of preventable harm to a patient during the process of healthcare and the reduction of unnecessary harm associated with healthcare to an acceptable minimum. This means that as paramedics, we are at risk of causing preventable harm to our patients when we do not effectively communicate with the receiving healthcare team. As a dual degree paramedic and nursing student, I have had the unique opportunity to experience handovers within the ward environment as a nurse and within the emergency department as a paramedic. This experience allowed me to practice my handover skills with a variety of medical disciplines. It is important to identify aspects that may negatively affect the process of clinical handover and documentation so that I may act to improve it for patient care. The emergency department is a chaotic environment. This may lead to the loss or misinterpretation of clinical information presented by paramedics. BOST 2012 reports that the nature, content, and quality of information passed between the ambulance service and hospitals vary, and appears to be based on handover method, language used, education level, and experience. The specific environment of the emergency department also presents barriers to effective communication, including factors such as overcrowding, increased stress, large patient loads, increased noise, and interruptions. Rie et al. 2017. Fernando, Ashted, Dev, and Fernando 2013. Each professional group has its own priorities and goals regarding patient care, such as resource distribution, time restrictions, and equipment availability. This results in inactive listening, disinterest, and lack of accountability for patient care. A study by Yee, Taylor, Knott, Dent, and McBean, 2007, into handovers in the emergency department found that in 15% of cases, information in handovers was perceived to be lacking, which led to adverse events for patients in 4.7% of cases. Adverse events may include medical errors, inappropriate escalation of care, misdiagnosis, delay in definitive treatment or discharge. Adverse incidences related to the miscommunication of clinical information or documentation may also lead to legal malpractice claims. To begin working toward overcoming the barriers of effective communication, strategies which are simple and deliver comprehensive patient information effectively and limit the probability of error are desirable for all healthcare professionals. In a review conducted by Dawson, King, and Grantham, 2013, paramedics acknowledged that the current practice of recording data in the field, including relying on memory, writing on numerous mediums such as gloves and ECG printouts, significantly impedes data accuracy and may result in the loss of information such as vital signs. Another barrier impacting effective interprofessional communication is differing handover methods. Paramedics, nurses, doctors, and other allied health staff use differing health handover techniques and language. In the interprofessional setting, this results in inactive listening and miscommunication of information. In addition to this, public and private hospitals have differing policies and procedures regarding handover. The Australian Commission on Safety and Quality in Healthcare identified clinical handover as one of its target policies. In its 2012 publication, it highlighted that the process of clinical handover varies highly between local and organisation-wide health service organisations. The publication acknowledges standardised and structured communication during clinical handover, more accurately transferring information, is shown to improve standard of patient care. Ray et al. 2017 adds that standardised communication ensures that patient expectations and needs are met within the emergency department. One method, which is discussed widely within literature, to standardising clinical handover is the use of the acronym SBAR: Situation, Background, Assessment, and Recommendation. The World Health Organization endorses the use of SBAR for improving common language for the transfer of critical information in clinical handovers. The use of the SBAR structure for clinical handover has been found to result in more consistent and direct handovers covering necessary information, which results in minimized assumptions and provides common expectations. With the use of common language and structured clinical handover is also associated with improved active listening by hospital staff. Randmar, Martisson, Sweeney, and Egerstrom's 2014 study into the use of SBAR's impact on communication and adverse events found a significant improvement in interprofessional group communication accuracy and the reduction in adverse events by 20%. After reflecting in depth into the topic of interprofessional communication, I have identified barriers and complexities that impact my future practice as a paramedic. Such barriers include the inherent chaotic environment of the emergency department, reliance on memory to recall data, differing handover methods, policies and procedures, and differences in language, resulting in inactive listening and miscommunication of information. Through my previous detailed experience, as well as research into current literature, I have deepened my understanding on the adverse events that may arise as a result of poor communication or documentation within the emergency department. Current literature indicates that the use of standardized, structured approach to clinical handover results in improved coordination of care and patient outcomes. In relating these findings to my future practice as a paramedic, I have identified a number of strategies to overcome the barriers to interprofessional communication. By using common language, providing accurate information, and practicing a structured handover, I will be able to relay clinical information to be understood by the emergency department staff. This will result in the reduction of unnecessary harm and continuity of care to patients beginning their healthcare journey within the ambulance service. Thank you.